let's shift to talking about other health systems who may be embarking on this for the first time in an environment where they really don't have the luxury of doing 2.5 years of planning, and they are trying to serve their communities as best they can through virtual care and would really benefit from your insight having sort of done this for a while. What would you say surprises senior leaders and those people you described on your team? What surprises them the most when they're planning and trying to deploy a virtual care model?
I think there's probably a handful of things that fit in there. I think in the clinical operations environment, I think one thing people don't realize right off the bat is that just accomplishing a video visit is sort of an entire workflow, right? It's you don't just connect a patient and a provider to a visit, but some patients need assistance in getting connected to tools or downloading information on their smartphone or how to log into a system and so forth. And on the provider end, some providers benefit greatly from kind of a workflow that not only provides the patient's assistance in getting access to it, but connects somebody with the patient to prep the patient and make sure that we had the patient good, set up, ready to go, the provider good, set up, ready to go. We got a match and now let's put you together, right? So it's kind of a whole workflow that accomplishes a single video visit. And you really need to be mindful of that entire workflow if you want to be successful in doing not just one, but a whole series of video visits for people as well. The other thing is I think it depends on where you are in the system. So when we were running for the past year and a half, what we were crafting a self-pay kind of cash business kind of thing where we said, okay, we're just going to allow somebody to say, I want to pay $30 and get an experience of an asynchronous visit, have an answer in 20 minutes. I may have spent $30, but I'm thrilled by the experience, right? And in that model, part of what pushes it is that has to be a really efficient model. If we want to deliver care for $30, right, we have to be really mindful of how do we frame this so that the provider time and the provider end is really efficient in there so that they can actually do this pretty quickly so that from a $30 perspective, it works for the system. So, the marketplace here that we need to be respectful of really also demands efficiency in how we think about delivering these tools. And if we're really, you guys are on the consumer end and marketing end of things, if we really think about that end of things, we have to be pretty mindful of how that all works out. And we can't just sort of think sometimes the way we do in a traditional healthcare structure, which is a little different.
That makes a lot of sense. To your point, you're talking about, the fact that this is not just you connect a physician and a patient. There's an entire process that goes into this. What are some of the milestones that we need to be looking at in order to onboard and prepare physicians to deliver care virtually?
I think one of the milestones is actually getting them to do one, right? Like there's a milestone in, as a doctor myself, you tend to think a little bit of your traditional way of providing care. A patient comes into the office, I sit down with them, we talk, we're face to face, I examine the patient, we do work together in that way. And that's a very important process and a very important way for care to happen. But once you get a little bit of experience, you start to sort of open your mind up a little bit and say, well, wait a minute, there's actually a whole lot of stuff I can do. Whereas before, maybe you were thinking about the things you can't do when you do a video, you start to think about the things you can do when you do that, and you can create a connection with the patient that's different than talking to them on the telephone. When you can see somebody's expression, especially when you're dealing with clinical things, you can see somebody's expression and tell if they're in pain, or you can get a sense of their suffering much more strongly than you can over the telephone. And you can interact and you can see how somebody responds to something that you might say to them. And you see if something you might say to them sort of created anxiety for them from their response, the way we can in an outpatient office when we're sitting down and talking with people. So once you sort of do one, you start to sort of see what you can do. And I think that opens up the realm of possibility, which is a piece that's really exciting for us when we look at this. And for a lot of people in this world is with COVID, we have a whole lot of providers who had never done a video visit before, who now have touched it, right? And in some ways, their minds are being opened up to saying, oh, wait, I get it. And as you could guess with anything, there's a spectrum. Some of those providers who are doing those visits were people who already did video calls and they were already in that world and they kind of already got it. And some of them were people who had never done a video encounter of any kind, medical or social at all. And they're getting opened up to, well, wait a minute, I really do get nice video and we really have a nice infrastructure and I really do have a sense of a conversation together with the patient when we're doing that. So that to me is the biggest hurdle. Getting people started really then I think opens up the realm of possibility.
Unless, of course, you're like my primary care provider, who I've been with for, I don't know, a ridiculous amount of years at this point. And during our video visit, she was like, I know the worst thing about this is that you can't go to the gym. I know, I get it. And she just intuitively knew that that was like probably the worst thing about this whole ordeal for me. Because you have that rapport already built up and you have that relationship already built up.
Absolutely, right? Like, so when we talk about even our on-demand care, that's very transactional, where we're treating you for something and we say hello, we interact with each other, we create a good response to it, and then we each go on our way, right? That is not a replacement for a primary care doctor, right? It's really another component of the healthcare system that can be a beneficial thing, but there's tons of value to that primary care doctor who knows you. And so taking that relationship and enabling that relationship with video is a whole additional piece of this, right? That is really, it's very multifaceted in some really neat ways.